Dr. T, I've got another question for you.
Sure thing. What's up?
Does a mom's state that they're in affect their baby at all?
Yeah, 100%.
Okay.
And yeah, it's like they're like little ones are like radars. Right? I mean, their bodies are just constantly learning the environment around them. They look to, especially mom, for that sense of is everything okay in and around the world, right? And this goes even into when little ones in utero too. I mean, they're connected, and this is our first experience in life. What's going on the outside is through maternal experience, right? Because the maternal stress can definitely relate into the growing fetus as well. But especially, again, when little ones are in this world, they look to mom to regulate. Their nervous systems are not obviously developed yet, and they're looking for that state and sense of ease in and around them. So it's really important for mom to be aware of her state. If you ever even seen a baby or even a kiddo that may be like freaking out, if the parent's freaking out too, it just feeds and it kind of like is like adding gas to a fire. Where if the mom or the parent can be more in a state of ease, then they can read that and start to get more ease in their nervous system. Yeah.
Cool. Yeah. I've heard this thing called co-regulation. Yeah. What is that?
And that's co-regulation is using that other being to help regulate. And so regulating is being able to help calm your body, calm your nervous system. And we've got what's called the autonomic nervous system within us. And there's the state to where creating more of that ease, again, that little ones rely on, particularly mom, to give them more of that sense that things are well in the world. And so co-regulation is they are using mom for that. Because a lot of times too, our regulation is what's in the prefrontal cortex, and that's not developed or fully developed until way later on in life.
That makes sense. Yeah. You just mentioned the autonomic nervous system.
Yeah.
What is that exactly?
That's the part of the nervous system that we are not consciously aware of.
Okay.
Right? That it runs the show. It controls and coordinates everything going on behind the scenes. Whether it be breakfast you ate this morning and it just goes through the digestive tract, you didn't have to think about it again. To your body repurposing and getting rid of red blood cells and producing them every 120 days. It's every process, and the trillions of bits of information that are going on every moment is through the system. Now, there's what's called the sympathetic side, which is our protection side. Most people have heard of the fight-flight system. If a lion jumps out, we kick on, and we're ready to fight something or run from it for our safety and survival.
Right.
The other side, which is where we should be in the majority of the time, is our parasympathetic. This is our rest and our digest, our growth, our development, our regulating side of the system. And that's where we get more of that state of ease and calm.
Okay, so like during pregnancy and after, like into birth and whatnot, what can affect the autonomic nervous system?
So it's life. The common things during that period of time, again, it's the physical, chemical, and emotional stressors that can impact things, but it can even start in if there's any difficulties in fertility, of needing any sort of support and interventions to get pregnant. That could be one of the factors. Maternal stress, like I mentioned before, that is a component, whether it be physically, chemically, or emotionally for mom during that period of time. The birth process itself, not only physically stressful on each and every one of us. I mean, there's research that shows that 99% of us that come into this world, which we do, no matter which way we come, but even in the easiest labor delivery vaginally, 99% have an impact on stress and strain in through the upper part of the neck based on just the process. And then you can kick it up and increase the odds of that stress and strain when there's interventions, and whether that be Pitocin for induction or speeding things along, whether that be forceps or vacuum, where they're pulling upon this infant's head and neck, and even too where most that have gone through or think about a C-section where it's, especially if it's a planned one, it seems like it's a pretty easy process, but many times the point of contact to get little ones out is the head and neck and pulling on that. Right. But especially if there's an emergency C-section where it is like time is of essence, they're really getting little one out as quick and as fast as possible.
Yeah.
So those are some of the things in and around, particularly that birth process that can be affecting the autonomic nervous system. But even too, then like when we're in this world, right? Then it can show and display some of those signs that there's stress on the system. And particularly, it can show up in little ones where it affects eating, sleeping, and pooping.
Gotcha.
So those are common things like colic, reflux, constipation in infants, difficulty sleeping appropriately, age appropriately, again, because they don't sleep through the night right away. But if they're stiff, irritable, difficulty turning their heads or have a dominance in one head, difficulty latching or keeping a latch, those are signs that there's stress on the nervous system.
Okay, that all makes sense. Is there a way for this co-regulation to be measured?
Yeah, and there's definitely a way. What's awesome about technology is when you get development and you get non-invasive ways to be able to assess that co-regulation. That is particularly make sure we're getting both mom and little one checked, because it's all through the nervous system.
Mm-hmm.
Because if one or either of them, especially with mom affecting little one, mom's nervous system is dysregulated, literally subconsciously can be experienced through a little one. So getting mom checked, but also two little ones to get checked to make sure that system isn't so prone and so sensitive to picking things up. Because if it's in protection, now if you've ever been in state of stress, you're always aware, right? Always on guard. That sensory system gets heightened. And so it can pick up, as they are radars, they could just pick it up even more if their nervous system is in that state. And that's what that technology helps to be able to assess and test for.
After you get that neurological scan, if there is stress found in the nervous system, what can be done? What should we do?
Yeah. So now, from that test, now we know, one, if there's stress in the system, we can see exactly where it's at, and then you can care for it specifically based on those stress patterns. And so that's where care planning can be so much better and easier and more effective. Once you know, then you can care for it much better. Okay. So that's where, once you have that test and reaching out to anyone that part of that has that and you can utilize it, whether it be us or someone else, then you can get care planning and care for much more effective.
Okay, got it. So get mom and baby checked. Thanks.